the fall, how it ends. It's the fall, how it ends. Or it's the fall, how we rise again. Ooh.
Hello everyone, welcome to another session of PhysioTV. I am Dr. Shiwangi Kumar, a final year postgraduate student in community physiotherapy here at Sancheti Institute of Orthopaedics and Rehabilitation, College of Physiotherapy. The topic for today's session is disaster management and healthcare perspective in disaster management. So first, we'll be coming to the definition of disaster management. The World Health Organization, that is the WHO, it defines disaster as an occurrence disrupting the normal conditions of existence and causing a level of suffering that exceeds the capacity of adjustment of the affected community. Many different institutes, they give the definition of disasters which are on the same lines. Some of these organizations are the United Nations Office for Disaster Risk Reduction, the UNDRR, and the IFRC, that is the International Federation of the Red Cross Society. So, coming to the classification of disasters. So, these disasters, they can be caused by natural causes or by human causes. Okay. Also, they can occur suddenly, that is of sudden occurrence, or they can occur progressively, that is a gradual occurrence. Okay, so some of the examples are storms, heat waves, the earthquakes and the volcanic eruptions that occur. They occur by natural causes and they are the sudden onset disasters. The disasters like landslides, the floods, the epidemics, they occur progressively or gradually over a period of time. They also come under the classification of natural disasters. The disasters like fire, explosion, collisions, the structural collapses of the buildings. These disasters are caused due to human causes and they also come under the sudden occurrence disasters. The next category is the disasters that occur due to humans, but they are of gradual progression. They occur gradually. So these are the environmental pollution or the economic crisis that occur. There are some more classifications of disasters, that is the small scale disasters and the large scale disasters. The small scale disasters are the ones that affect only a small local community and they do not require an assistance of a national or an international level. But the large scale disasters, they affect the whole society or a country as a whole. And these are the disasters that require a large scale assistance. That is maybe an international assistance or a national assistance. Next is the frequent and the infrequent disasters. So these are classified on the basis of the frequency or the probability on which they occur. And the slow onset and the sudden onset disasters are the ones that we saw in the previous slide. Now, coming to the impacts of a disaster. So, the impacts that a disaster can cause, they can often be widespread and they can last for a long period of time. So, these impacts, they come under three categories: the physical impact, the economic impact, and the psychological impacts. Okay. So, the physical impacts are the ones that occur to the human beings. So the fractures, the burns, injuries, wounds, infections, the chronic illnesses that occur due to the disaster, they all come under the physical impacts of the disaster. The economic impacts, these are the impacts that are related to the livelihood and the vocational aspect, the job related aspects of the people, and also to the environmental issues that happen. So the environmental damage and the environmental degradation that happens after a disaster, the unemployment that is created amongst the people, the damage to the infrastructure and the resultant loss of shelter and normal living conditions of the people. These all come under the economic impacts of the disaster. Next is the psychological impacts. So the psychological impacts, they are the impacts that a person experiences after a disaster. So these can be the emotional distress that a person is experiencing, the anxiety, the depression, the post-traumatic stress disorders. Now coming to some statistics that are given by the UNDRR, that is the United Nations Office for Disaster Risk Reduction. So these statistics are from the year of 2001 to 2020. It gives the annual average number of deaths that are caused by the disasters. So earthquakes have caused the maximum number of deaths annually, followed by storms and then extreme temperatures. Also, the average number of people who were affected by a disaster in millions. So there were 82.7 million people who were affected by floods, 67.5 million people were affected by droughts, and then 37.4 million people affected by storms. So now coming to the concept of disaster management. Now the disaster has occurred. Yeah, it is going to occur. Now how we will manage the disaster? So the American Physical Therapy Association, it defines disaster management as the organization, planning, and application of the measures that are involved in preparing for, responding to, and recovering from the disasters. So the measures that are taken to organize, plan, and apply the strategies and the plans in case a disaster occurs. These all things come in the disaster management program. So what are the goals of this disaster management program? The first one is to reduce or avoid the losses that can occur due to the disaster. Second is to assure appropriate assistance to the victims, appropriate help to the victims of the disaster. And next is to achieve a rapid and effective recovery after a disaster settles down. So ultimately, the aim of disaster management will be to reduce the harm to life, property, as well as the environment. Next, coming to the disaster management cycle. So the disaster management that we have looked at, it comes in certain processes. So the disaster management cycle, it is the ongoing process through which different agencies, that is governmental agencies, different business people, the different society, the civil society, they all collectively, they plan for and they reduce the impact of disasters. Also, they plan on how to react during a disaster and immediately following a disaster, and what steps to take to recover from the disaster. This definition is given by the GDRC, that is the Global Development Research Center. So coming to the stages in disaster management. Okay, So now there are 4 stages in the disaster management cycle. The first one is the prevention or the mitigation stage. The second is the preparedness stage. The third is the response and the relief stage. And fourth is the rehabilitation stage. So coming to the first one, the mitigation prevention stage. So in this stage, steps are taken to avoid the adverse impacts of a disaster in case the disaster occurs. Okay. So these steps are taken through the actions that are taken in advance, that is through the proactive measures by the different sectors involved. So for example, there are the embankments or the dams that are made. Dams are made in the high flood risk areas to eliminate the flood risk. Also, there are land use regulation plans. So these land use regulation plans are so that to avoid the settlement in the high risk zone areas. Okay. Next, coming to the preparedness stage, the second stage. So in this stage, pre-disaster activities are undertaken within the context of the disaster management. Okay, so in this preparedness stage, risk analysis of the area will be done. Also, the people will be trained on what to do when a disaster occurs, where to go, and whom to call. These are the 3 main things. If a disaster occurs, so we all should know what we have to do, and where we have to go, and whom should we call for help. So the mock drills that we have always seen in our schools or colleges or the institutions that we are working in or we are a part of, every institute runs some mock drills. So these mock drills are an example of the preparedness stage. Now, next, if these 2 stages, the prevention and the preparedness stage, these are the 2 stages where that are to be prepared before a disaster. Next 2 stages, the response and the rehabilitation stages, they are the stages after a disaster occurs. Okay, so now if in case a disaster occurs, what we'll do? So next, immediately following the disaster will come the response and the relief stage. So in this stage, maximum actions, they are taken to eliminate the impact of the disaster or to reduce the impacts of the disaster that we have seen as much as possible. So the goal of this stage, it will be to ensure the survival of the maximal possible number of victims, to provide them with the best possible healthcare services available and the basic necessities. And then comes the rehabilitation phase after some months of the disaster, after some days to months, and it continues. So in this recovery stage, it is the stage in which the life of the community, of the people of the community, it returns to normal. And we have to restore to the nearest possible capacity that was available previously. And also, here we have to prevent the relapse of the disaster. So this is the rehabilitation stage or the recovery stage. Next, coming to the Disaster Management Act. So this Disaster Management Act, it was enacted on 23rd December 2005 by the Government of India. And the aim of this act was to build a safer and a disaster resilient India by a holistic and an integrated approach. So the planning preparedness strategies that we have seen in the previous slide, that is the stages of the disaster. The Disaster Management Act fits into the strategies that are planned so that we can build a safer environment and a better recovery should be possible. So, to minimize the detrimental effects or to minimize the impacts of a disaster, it is important to generate a heightened level of awareness on disasters, and disaster management will start from increasing the awareness to the people. Next, we'll talk about the health perspectives, healthcare perspectives that in the disaster management. So coming to the objectives of the healthcare perspective. The objectives of the healthcare perspective in disaster management, they'll be to promote health and to preserve it as much as possible, to restore the health when it is impaired, and to minimize the sufferings that have happened, and to minimize the impacts of the disasters. So there are these 5 E's of prevention. First is education. So educate the ignorant, increase awareness among them, enforce regulations and measures, health promotion and prevention measures, employ safe infrastructural practices, economic safeguards, and evaluate and re-estimate. Next, coming to the principles of this healthcare perspective. So, the healthcare perspective, it should be an all hazard approach. So, the strategies or the response systems that are built up, they should be such that they are effective during all types, almost all of the types of disasters. It should not be that we are developing one strategy that works only in one disaster. That will be a very tedious process. So it should be an all hazard approach that works in all kinds of disasters. The approach should be a multidisciplinary and a multidisciplinary and a multisectoral one. So different disciplines and different sectors of the community, like the governmental sectors, the non-governmental sectors, private public initiatives, the national and international agencies, state governments, every aspect, every discipline, every sector should be involved in the healthcare management. And lastly, the approach should be a comprehensive one. So, comprehensive meaning the planning that we are doing for the strategies, it should match up all of the stages. It should match up for all of the stages, including the preparedness response stages. Then coming to, we'll quickly see what is important for us from our perspective, from the healthcare perspective, and then we'll come to the physiotherapy perspective in disaster management. So firstly, triage. So triage is the process of quickly examining the patients who are taken into the, who are then taken to a hospital in order to decide which ones are the most seriously ill and who must be treated first. So in the triage, there are some color codes, that is the red, yellow, green, blue, and black. According to these color codes and according to the priority of the person, of the victim, these people are given this color code and then they are taken to the hospital and treated according to the color codes. Next is the victim evacuation techniques. So after we have labeled the victim according to the triage color code, we should know how to evacuate the victim. So there are some techniques which involve a single person. There are single person techniques and there are 2 or 3 person techniques. So these are the techniques that are used to evacuate the victim or the injured person from an emergency scene to a location of safety. So there are some types of lift, carries, and crawls. The ones that a single person can do are first a tied hands crawl, that is evident in the first picture. The next one is the one person arm carry. Next is the blanket drag, the ankle pull or the ankle drag, and next is the shoulder pull. Now we'll see some techniques that can be performed by 2 persons. So there is 2 person carry, chair carry, then seat carry. And then there is this 3 person carry in which 3 people of the healthcare team, they will help to evacuate the victim. Also, if at the site of the disaster, proper stretchers are not available, improvised stretchers can be used. So for this, we can use the bamboo sticks and the t-shirts or the bed sheets available at the site to make these improvised stretchers. Now, cardiopulmonary resuscitation, we all know that this CPR is an important part at the site of the disaster. So it will, the person should be given CPR if necessary and immediately call for the healthcare team, emergency healthcare team. Now coming to physiotherapy perspective of disaster management. So we'll go stage wise here. So firstly, coming to the preparedness stage. So in the preparedness stage, we as physiotherapists, we play a part in creating a link between the hospital and the community health services, and also increasing the awareness among the members of the society, that is the public. We also can consider that a small group of physiotherapists come together who are having an interest in disaster management and an expertise in disaster management. We can form a small subgroup and then create awareness among the people. So here, the first role that we play is in planning and coordination. So in planning and coordination, we can give our inputs in the preparedness planning at the organizational levels, national levels, or international levels, and coordinate with other professionals also. Then coming to advocacy and awareness. So here we can advocate for the vulnerable groups of the society and also create awareness among the general public. Next, by stockpiling equipments and supplies. So stockpiling equipments and supplies in case an emergency occurs for relief activities, and the assistive devices like wheelchairs, crutches, splints, they should be stockpiled so that they can be used if a disaster occurs. Next, coming to training. So we can provide training to people in how to be effective in the cases of emergencies or the crisis situations. You can also provide training to people in respiratory physiotherapy, in splinting, wheelchair management and prescription, providing first aid to the people at the site of emergency. And lastly, in the acute management. So, in the treatment of acute musculoskeletal injuries to the victims, or in the acute management of spinal cord injury or fractures and burns, amputations that might occur at the site of the disaster. Next, coming to the response stage. So, we know that this response stage is this stage immediately after the disaster has occurred. So, this stage lasts from a few days till a month. In this stage, we as physiotherapists may work as a part of the emergency medical team and in identifying the people with existing disabilities in the shelters or the camps in which they are kept. Here, firstly, immediately after the disaster has occurred, the first step is the search and rescue step. So in the search and rescue step, we'll search and rescue for the survivors, quickly providing them with first aid, food, water and shelter, whatever they need. Then secondly, screening and transferring them. So quickly screening them according to the triage code and transferring them according to the victim evacuation techniques. Then acute management of injuries. So injuries should be managed as quickly as possible by dressing of the wounds, then by applying braces whenever needed, and by providing assistive devices. Then also mobilizing and positioning are very important to prevent the potential secondary complications that can occur following the injuries. Then by providing the equipments like wheelchairs, the assistive devices, by prescribing them, helping them to fit it, and training them for those assistive devices. Then we also play a role in discharge planning. So we coordinate with the other healthcare members in the team. We coordinate with them for the discharge of the victim, referral of the victim to another healthcare level or another healthcare team, and we also follow up for that victim. Then provide helping people communicate and developing a long-term recovery strategy for the victims. Next, coming to the recovery stage. So this stage of recovery and restructuring, it aims at restoring the normality. So reaching to a point where the way of life is either equal to that before the disaster or it has achieved a better state of functioning. So here we as physiotherapists, we will help people in the rehabilitation process. So continuing the care. So in continuity of care, rehabilitation services will be provided to restore, enhance and restore the functional capacity of the victims and maximizing their quality of life. Also, this rehabilitation can be provided through community-based rehabilitation or institution-based rehabilitation. And orthotic and prosthetic support and assistive devices, referrals, they all will come under the continuity of care spectrum. Next is supporting those with existing and new disabilities. So helping them in their functional rehab, helping them with their vocational training, the vocational rehabilitation, helping them with their modification of the environment and engagement of these people, those people who have gained disabilities with the disabled people's organization. Next, coming to accessibility and universal design. So we know that this recovery stage is followed by the reconstruction phase. So in the reconstruction phase, whatever damage has occurred to the environment, it has to be repaired. So why not make things new so that they're accessible for everyone? So creating a design for all or universal design, this concept should be inbuilt in the rebuilding process. And then providing advocacy for the inclusion of people with disabilities in all the aspects of the society. So this Build Back Better, BBB, it is a post-disaster reconstruction and recovery strategy, and this is an example of this recovery stage. And here in this strategy, the disaster, it is seen as a chance to improve the community's resilience along with reconstruction and recovery efforts that will empower the survivors. So the Build Back Better basically is on the concept that the disaster gives us a chance to make the environment more accessible for everyone, even including people with disabilities. Now coming to the NGOs. NGOs are the non-governmental organizations and they play a major role in providing humanitarian assistance, development. Also, they play a role in the preparedness stage and mitigation stages in helping to plan the strategies and plans, and most importantly in providing the relief to the disaster affected communities and the victims. So the NGOs, they work on three principles: humanity, neutrality and impartiality. So these three are the basic fundamental principles of the NGOs. So some of the NGOs, yes, so some of the NGOs that can be contacted for disaster management, that help in disaster management, whose main aim is providing relief to the people or the victims of disaster, are the Seva International, the Indian Red Cross Society, the Charities Aid Foundation India, the Rapid Response, and the Sakar Relief Fund. These are some of the helpline numbers that can be contacted in case a disaster occurs. So, for a fact, 13th October is designated as the International Day for Disaster Risk Reduction. Also, 1990s was the International Decade for Natural Disaster Reduction. And the mission statement for disaster reduction is prevention rather than just the rehabilitation. So, working in all the stages to prevent the disaster as well as rehabilitate the victims. So, thank you. I would like to thank Parag sir and Manisha ma'am for their constant guidance and support. Dr. Apurva sir, the principal of our college, for giving me this opportunity, and our PhysioTV technical team and all the loyal viewers. See you next time.